Hi, my name's Dr. Robert Kruse. I'm a physician at Harvard Medical School.
Hi, I'm Yuting Huang. I'm a physician at the University of Maryland Medical Center Midtown campus.
We're excited to talk to you about our recent publication, GIE, entitled Endoscopic-mediated biliary hydrodynamic injection mediating clinically relevant levels of gene delivery in pig liver. The study was conducted at Johns Hopkins University School of Medicine. We were motivated to conduct our study to address the many rare genetic diseases affecting the liver. These include hemophilia A and B, which patients must get weekly injections costing several $100,000 a year in recombinant factors. Other diseases of interest include familial hypercholesterolemia, Wilson's disease, and potentially in the future HCC, as well as NASH and NAFLD. Currently, the state-of-the-art for gene therapy is the use of viruses, and specifically adeno-associated viruses. These have been used in several trials for hemophilia, but have not always shown to mediate significant clinical expression and have several toxicities. Most importantly, adeno-associated viruses and other viral vectors trigger an immune response, effectively vaccinating someone from ever getting this gene therapy again. Given that the liver slowly divides over time, this means that any gene therapy delivered would ultimately be lost. Seeing this as a problem, we sought to develop a non-viral approach that would not use any viruses to deliver genes inside the liver. We sought to use plasmid DNA, which is the starting material for various pharmaceutical processes, including making viral vectors, as well as mRNA vaccines, and see if we could deliver that directly inside the liver. We chose a hydrodynamic route in which we use a fluid force to press open transiently holes inside liver cells in order to deliver the DNA inside the cell. This hydrodynamic force, we believed, could be delivered through the biliary system. The biliary system is very small, but effectively contacts all hepatocytes, totaling around 30 mLs in total volume. Endoscopists would recognize that we regularly access it through ERCP, totaling hundreds of thousands of procedures worldwide. While ERCP is commonly used to remove stones and other biliary pathologies, we thought we could turn it into a gene delivery procedure. We first tested the safety of our idea accessing the pig's biliary system via ERCP. Pigs were chosen because they have an effective size of a young adult female. Thus, any findings we would conduct would be applicable potentially to a human population. We found that even if we injected high levels of fluid, 30 mLs total at a high flow rate, 2 mLs per second, the pigs tolerated the procedure well with minimal toxicity. There were no elevations in liver enzymes. The imaging findings on ultrasound and CT also showed no disruption, and repeat fluoroscopy after the injection, so no rupture of the biliary system. For our model gene, we chose hemophilia B, and specifically factor IX. Delivering human factor IX to the liver, we saw that we can mediate up to 50% in some lobes of pig liver, expressing the human factor IX gene, which we assessed on immunohistochemistry. Importantly, this was observed in all liver lobes and in every lobule, suggesting there was a homogeneous distribution of the DNA into the entire liver.
Post-ERCP pancreatitis is a side effect which can happen after ERCP procedure in the patients. But due to the pigs and the anatomy is different than human, the common bile duct opening and the pancreatic duct opening are separated in the pig, so we were not able to evaluate this clinically relevant side effect in our animal model. So the next step, we are planning to use non-human primate.
We note that the best AAV transduction published in primate models, which average around 10 to 15 kilograms, only is about 20%, suggesting that we're already via a non-viral strategy comparable to the best AAV data. Taken together, we're really excited about our approach. The plasmid DNA that we used in our experiment is much cheaper, around the order of 100 to 500 times cheaper than any adeno-associated virus or other viral vector system for gene therapy. This means that it might be feasible for any endoscopist who is trained in ERCP to contemplate gene therapy through the simple ordering and production of GMP-grade plasmid DNA. This could truly open up both any rare disease as well as more common metabolic disorders to gene therapy through procedures that are already done thousands of times around the world and with trained endoscopists who are efficient in it. Whereas current gene therapy can only really be done rare diseases because it's so expensive, we believe that the ERCP-mediated gene delivery could become a new standard of care to treat fatty liver diseases, cancer, viral diseases, and starting with, of course, rare diseases such as hemophilia, familial hypercholesterolemia, Wilson's disease, and others. We're really excited to continue building on our work in the future and are actively looking to push our technique into clinical trials, starting with various rare liver diseases. We'd like to thank everyone for their time and would welcome any collaboration in the future and interest in our work.